The Health Department says it is studying a High Court ruling which has ordered it to make public COVID-19 vaccine procurement contracts.
Officials have 10 days to hand over documents and minutes of negotiations to the Health Justice Initiative. There are concerns that Pfizer and Johnson & Johnson shots may have been procured at inflated prices when compared to global standards.
Well, the Health Department says it will respond, but only in due course.
Well, of course, joining us tonight for more reaction on the story is the Health Justice Initiative founder and director, Fatima Hassan. Fatima, while the Health Department mulls over this latest court decision, I mean, there's no taking away the fact that it's been a long fight for yourself, for the organization that you represent. Can you believe that finally you are here? The court seems to agree with you in terms of having those documents made public.
Thanks, Kathy. And I think the court was very alive to the urgency that we were arguing for the disclosure of the contracts, and they certainly upheld our argument that it's in the public interest for this disclosure to take place. And you mentioned that the department is reading the judgment. Well, they have very few days to do so. The court has instructed that within 10 court days, they have to hand over all the documents. So we look forward to receiving that. And we look forward to our government not, delaying this matter any further and actually making that information available.
Part of the suggestion for why it is that an organization like the Health Justice Initiative would want these documents in the first place is that, there have been suggestions that it's for sinister reasons and that, the process of negotiation is not being completely respected because these were confidential conversations, confidential agreements that may have unintended consequences if they're made public. Do you feel that an argument like that simply holds under the current circumstances?
Thanks. So it certainly wasn't upheld by the court. The court found that the arguments around the potential prejudice to the department in future negotiations didn't stand up. It also found that their arguments on confidentiality would not trump the public's right to have access to this information. And you must remember, Kathy, that nobody has alleged that anything illegal has happened. That is not the reason why we want the contract. Why we want the contract primarily is to have a sense of the terms and conditions imposed by big pharmaceutical companies who bullied governments in the global south. So we certainly cannot have a situation under national health insurance or in the next pandemic where pharmaceutical companies simply demand secrecy and our government then has to agree to it. And in this particular case is also defending it. So I think that argument doesn't hold any sway, and certainly the court has basically found in our favor in those respects. In addition to, arguing that the pharmaceutical company should have been brought into the case, the court was very clear that the onus in relation to that was actually on the department because, and to use the court's words, we were rebuffed in our many attempts to try and find out even the contracting party's details. So definitely nothing sinister in the public using South Africa's laws on access to information and our constitutional right to have access to information, particularly where public money has been used, and especially in a context where there are so many and growing reports of health corruption in procurement.
Fatima, I think there are also important lessons to draw out of what's happened under COVID-19 and, of course, subsequent applications like the one you've brought forward here. And it's really sort of what it is that the state can agree to, like you said, using public resources with private partners. The incredible lessons there, because while we look back at COVID and also equally commend the fact that the private sector and public sector were able to come together and work collaboratively in a way that we haven't before, there are, of course, imperatives on the public sector that the private sector doesn't necessarily have. And the emergency of the situation or the crisis doesn't necessarily take those away.
Yeah, and certainly our government, irrespective of what a pharmaceutical company desires or wants, has a duty to uphold the principles of transparency and accountability. We live in a constitutional democracy, And we've said from the very beginning of this case that it's unacceptable for very profitable and very wealthy multinational pharmaceutical companies to come into the country and distort our democracy. And they didn't just do it in South Africa. They've done it everywhere else. And so the net result of that is that they've sullied our entire vaccination program with this much level, of secrecy and confidentiality for no good public interest reason. So we certainly want these contracts to be open. We will do whatever, it takes within our power to make sure that the court judgment is actually respected and that it's upheld. And we're really looking forward to the Department of Health making all of this information available now.
To those who say, we're past COVID, and a lot of the vaccines, of course, have had to simply be destroyed because there just wasn't enough take-up from the South African population, and who question why it is still worthwhile to have these documents made public. What would you say?
I think there's three reasons for that. The first is that there are global negotiations currently underway on what's called a pandemic treaty, and transparency is really at the heart of those negotiations. And we need to be able to ensure that in the next pandemic or in the next public health crisis, that no company can demand of a government in the global south for total secrecy and also for total immunity. I think the second reason why it's significant that we actually have a proper articulation of this issue in our courts and that there is disclosure in the public interest is because of looming national health insurance. If you allow this to happen in this particular state of disaster or pandemic, because negotiated at a time of a disaster, then that's the principle you'll be allowing for national health insurance procurement. And thirdly, I think that we have to hold private power to account. And so what these companies have actually done is basically given a bad name to the private sector who worked really well with our government in trying to have this program. Now, you mentioned unused stock. What we'd like to see in the contracts is what are the provisions relating to that? Are there penalties for these companies for delivering supplies to us months later than what they had promised? What are the breach provisions? What were the export restrictions imposed by these companies on our government to benefit Johnson & Johnson in particular in its own separate contract with another pharmaceutical company in South Africa? So there's a lot of elements that need to be unpacked, and I think we really want to see what's in this context to be able to provide a proper assessment to understand what really happened.
All right. The Health Justice Initiative's Director and Founder, Fatima Hassan.